Hi friends, today I will tell you about PCOS. Sounds funny, right? This PCOS, that's a short form of Polycystic Ovarian Syndrome. Many young women have a file with them, a scan report, saying that they have polycystic ovarian syndrome, and then they go for doctor shopping. But they don't seem to be satisfied with anybody, so they keep again and again going to different doctors. The doctor can only advise and give certain medications to control it, but the problem solving is in the hands of the woman who is suffering from it. How does this polycystic ovaries happen? All of you know there are two ovaries on either side of the uterus. These ovaries are the structures which produce ovum. When they are plural, we call them ova. The ova are in the structures called follicles. These follicles are like water bubbles. In a scan, we can see these follicles, not actually the ovum. Soon after periods, some 4-5 follicles try to develop, and among them, one of them will be smarter, develops, becomes a dominant follicle, matures, bursts open, and releases the ovum inside. In a woman with polycystic ovaries, too many follicles try to develop, around 10 to 15. None of them mature and release the egg. If there is a release of egg, that is called ovulation. If there is no release of egg, it is called anovulation. So when there is no release of egg, what will happen? It is not possible to become pregnant, or the chances become less. When there is no ovulation or the release of the egg, what happens? The ovaries secrete male hormone. Yes, you heard it right. There is a little amount of male hormone in every female that is secreted by the ovary. In case of polycystic ovaries, when there is no ovulation, the amount of hormone that is secreted becomes more. So when the male hormone secretes, what will happen? Male features will develop. What are the male features that will develop? A little mustache, beard, hair growth all over the body. The severity may be different in different people. Some people may have only a mild mustache. Some people may have a real mustache where they have to shave. I told you how it happens. Then why does it happen? When the woman eats more than what she needs, or if she doesn't do adequate exercise, then the amount of fat in the body becomes more. When there is more fat, this fat by itself secretes estrogen. When there is so much estrogen in the body, the brain interprets there is enough estrogen, so there is no need for follicle development. So what happens? Whatever follicles were recruited, they don't develop. When they don't develop, they don't release eggs. At the same time, because of the obesity, there is what is called as insulin resistance. Also, when the woman overeats, what happens? The pancreas in our body secretes more insulin to burn the extra calories that she takes. Unfortunately, the amount of fat is so much, but the normal amount of insulin is not sufficient. So the pancreas keeps secreting more and more of insulin. So they end up in a condition called hyperinsulinemia. For the insulin to act, there has to be some physical activity. If there is no adequate physical activity, in spite of the high insulin amount, the fat or the glucose is not burnt. That is called as insulin resistance. So these people have more insulin, still the insulin is not able to do its duty. As a result, these women will develop diabetes in the long run. What are the other effects of polycystic ovarian syndrome? Because of the continuous estrogen secretion, the endometrium keeps increasing in thickness, and that results in heavy menstrual bleeding. Heavy menstrual bleeding leads to anemia and weakness. Constant use of napkins may produce what is called as monilial infection, and added to that, the obesity and the diabetes increases the chances of monilial infection. That is a fungal infection of the external genitalia. 3 women came to me with 3 different complaints, and the diagnosis was one, that was polycystic ovarian syndrome. But the medications given were different, but the advice given was one, that is diet and exercise. The first girl, she was in her early 20s. She said, I'm not planning to get married, doctor, but my periods are irregular. I'm not able to predict when it will come and how long it will last. And it's very difficult to plan any event for me. I'm interested in sports. I'm not able to go to any sports event. I'm not able to plan a visit to any temple or a tour. Suggest some way where I can have monthly periods. For these girls, we give a medicine called progesterone for 3 days in a month. Say if you are a person who will forget when was your last periods and you can't remember when to take the tablets, what I would suggest, the woman can take the tablet on 1st, 2nd, 3rd of every month. After stopping the medications, 3 days later, she will get her period. That is on 6, 7, 8. Another lady came to me. She was married. She wanted to become pregnant. Her periods had always been irregular. For this woman, after the investigations, we will give them what is called as ovulation inducing drugs. Because the basic problem with polycystic ovaries was they don't ovulate or release egg every month. So for these kind of women, we give what is called as ovulation inducing medicines. The third woman, she came to me saying, Doctor, I have completed my family. I have 2 children already. My periods are irregular. I want to regularize my periods. At the same time, I don't want pregnancy. This sort of women, we can give oral contraceptive pills. That is pills which will prevent pregnancy. The oral contraceptive pills can be given to prevent pregnancy and also to regularize periods. For all these women, if they are very obese, we also give a medicine called metformin. This metformin is a diabetic medicine. Basically, all these women with polycystic ovaries, I told you, have what is called as hyperinsulinemia and insulin resistance. This metformin is an insulin sensitizer. It helps the insulin to act well. All these medications are not the cure for polycystic ovarian syndrome. The cure is diet and exercise. The one standard advice that we give all the women are avoid sweets and fried items, reduce the quantity of carbohydrates, that is rice, wheat, like any of these cereals, and work out more. Exercise is a must. It's not an option. It can be walking, jogging, playing shuttle, table tennis, dancing, swimming, anything that you like. Don't give excuses saying you don't have time. 3 to 5 minutes every 1 hour. If you do a little walking, stretching, on the spot walking, that is good enough. Switch on some music and dance in your room for half an hour. That is exercise. You don't need a special dress. You don't need a gym. You don't need special equipments. Very, very few women can have polycystic ovaries without being obese due to genetic reasons. For these people also, diet and exercise plays a very, very vital role. How long should you follow this diet and exercise? Lifelong. Basically, the problem of polycystic ovaries came because there were lifestyle changes which were not good. Now, you go back to lifestyle changes which are good. That is taking a balanced diet which is balanced in quality and quantity and adequate exercises. The polycystic ovarian syndrome is not a disease. It is because of bad lifestyle, and change it to a better one. You will keep it under control. The medications are only secondary. Diet and exercise are the most important one. Make an initiative. Your health is your responsibility. So take a balanced diet, work out well, and stay healthy. Thank you for watching this video. See you in the next video. Share, comment and subscribe. Thank you.